We will see why diabetes is so harmful. What are the complications? Complications can be divided into two broad groups, mainly microvascular, that is small vessel affected, retinopathy, neuropathy, and nephropathy, and macrovascular. First, microvascular, neuropathy. High blood sugar causes damage of the nerves of brain, hand, and feet, which is known as neuropathy. Once damage is damage for last time, so it is not curable, but you can prevent it with proper control of blood sugar. Retinopathy, high blood sugar level in the body decreases the blood flow in the retina, causes damage. There is retinopathy change. This causes vision impairment. Even this can cause blindness. Nephropathy, high blood sugar causes high blood pressure, which in turn causes kidney failure, termed as nephropathy. What are the macrovascular? Large vessel affected, coronary artery disease, cerebrovascular disease, and peripheral arterial disease. Heart affected can be different types like ischemic, high blood pressure, coronary heart disease, which in turn leads to even heart attack or even death if proper care is not given. Even the blood cholesterol level, especially LDL HDL imbalance and raised LDL, also can cause the heart attack, especially in diabetic patients who are really prone to heart problems. Now we will see what are the medications available for control of blood sugar. As the disease cannot be cured, we will have to control the blood sugar. First, we will start the medication. Medication can be oral, like sulfonylurea, metformin, DPP4 inhibitor, SGLT2 inhibitor, alpha glucosidase inhibitor, and thiazolidinedione. Or it can be injectables. First is insulin and GLP-1. GLP-1 is different from insulin as it is related to beta cell and alpha cell. GLP increases the insulin secretion, at the same time decreases the glucagon secretion, thus lowers the blood sugar. Insulin, mainly two types, basal and prandial insulin. Basal insulin usually have the duration of action 18 to 24 hours, thus control the sugar for entire day. In fact, a whole day the sugar in between the meals are controlled by basal, and liver output at the night time, liver output of sugar is controlled by basal. So fasting insulin is properly controlled by basal. But still, sometimes we need the prandial, that means the sugar rise after the food is not controlled by basal, and after some years we need the prandial. They usually control the postprandial blood sugar. Now, what are the other measures apart from the medicine which we should also give importance? They are exercise, which increases the insulin secretion. Regular 30 to 40 minutes exercise is must. We can do aerobic exercise, we can do swimming, we can do jogging, but one is sure that you will have to exercise to increase your insulin secretion and to lower the insulin resistance. Regular checkup helps to monitor your blood sugar, because blood sugar is not constant, it fluctuates. if you don't check up regularly, you will not be able to manage the blood sugar all time, and you will have to control the blood sugar for all time, not once. Next important is diet. In diabetes, small frequent meal is recommended so that sugar level never shoots up and never goes very down below the normal range. There is no misconception about there is very much misconception about the diabetes diet, so one should meet the nutritionist to know the proper diet. But as a whole, you will have to take major or rather we will call three mid-size meal, not very high but apparently sufficient, and three small meals, so that every 3 hours apart from 6 hours of sleep your blood sugar remains constant. Because nowadays concept is that you will have to control your fasting blood sugar, postprandial blood sugar, HbA1c, as well as glycemic variability should not be very high. You will have to remember this. So in conclusion, as we can see, though there is lot of complications out of diabetes if it is not controlled, but still there is hope, definite hope, if you properly control the blood sugar with exercise, proper diet and medicine. Medicine may be oral or insulin as we have discussed, and selection of medicine, whether insulin required or tablet required, should be given the choice by the practitioner or physician, not by the patient itself. Because if you need insulin, you should need insulin and you should take insulin to control properly. Because it is not one-time control, but you will have to maintain the control throughout your life to avoid the complications. So, go and visit your doctor and don't neglect. Let there a bundle of joy, happiness which is there in the life. You can enjoy life like many other men, women who are non-diabetic if you properly control your blood sugar, if you follow the nutritionist advice, if you follow your doctor's advice. Thank you.